UK Prime Minister Rishi Sunak apologized to thousands of people infected with contaminated blood in a decades-long scandal. This comes after reports of a 6-year-long investigation which shows horrifying results. Details from the investigation revealed that authorities knowingly exposed victims to unacceptable risks and even tried to cover it up. Sunak promised compensation that is expected to be above $12 billion when the government announces the package. Inquiry Chair Brian Langstaff said more than 30,000 people received infected blood and blood products in the 1970s and 1980s from Britain's state-funded National Health Service. Families of victims and survivors are still seeking justice even after all these years. Langstaff, who led a near 6-year inquiry, said the scale of what happened was both horrifying and astonishing.
Tragically, the infections happened because those in authority, doctors, the blood services and successive governments, did not put patient safety first. They lost sight of what was known about the risks of viral infections from blood. Doctor knows best was such a strong belief that health departments did not issue guidance to curb the unsafe use of blood and blood products. Decision-making on measures that could make blood and blood products safer was put off, then dragged out unnecessarily, and failed to reach clear and decisive conclusions.
The infected blood inquiry concluded that more than 30,000 people were infected with viruses such as HIV and hepatitis after being given the infected blood. Victims included those needing blood transfusions for accidents and in surgery, as well as those suffering from blood disorders such as hemophilia, who were treated with donated blood plasma products. Some 3,000 people died and more will follow in what has been described as the biggest treatment disaster in the 8-decade-long history of the state-run National Health Service. On top of the 3,000 patients who died, many more were left with lifelong health problems. In some instances, children with bleeding disorders were treated as objects for research. The report said that at one school where 122 pupils with hemophilia were given infected blood products between 1970 and 1987. Only 30 survive now. Blood donors were not screened properly and blood products were imported from abroad, including from the United States, where drug users and prisoners were used for donations. Too many transfusions were also given when they were not necessarily needed. There were even attempts to conceal the scandal, including evidence that officials in the health department destroyed documents in 1993. For more on this, we were earlier joined by our correspondent John Bevier, live from Bristol. Let's take a look at what he had to say.
This was a huge cover-up and something that went drastically wrong and went wrong for many decades. So, of course, that is something the government say they're going to put right, and they're going to put it right by offering up a compensation package which will run into the billions of pounds. So the government appreciating the scale of this, but just going over some of those details that you mentioned in terms of what happened. We found out, for example, that blood products weren't being heat treated despite the HIV epidemic that had emerged, and it ran for several years of blood products not being heat treated before these transfusions were given to some of the most vulnerable people such as those who have haemophilia or those who have been in accidents as well. So people who desperately needed good treatment and they weren't getting it. So yes, we heard about the lack of heat treating to minimise the risk of HIV. We heard about the cover-ups and, as you say, documents being destroyed. And the really, I think, striking thing is that this didn't just happen in one place or one hospital or one area. This happened across the country, and it happened for many decades as well.
For all the latest news, download the WION app and subscribe to our YouTube channel.